Hello everyone, I am Dr. Urmi Sheth. I am a clinical hematologist based in Pune. Today let's talk about what is hematology. Hematology is a subject which is dealing with blood and blood related diseases. What is blood? Blood is basically made up of two components. You have the liquid component, which is also known as the plasma, and you have the blood cells which are floating within your blood vessels. The blood cells are basically of three major types. One is red blood cell, a white blood cell, and platelets. All of these three are produced in your bone marrow. The bone marrow is a factory for producing these three cells. These three cells, once they get produced from the bone marrow, are thrown out into the circulation, and that's where they perform the functions that they are meant to. The other component is known as plasma. The plasma has certain other important blood related proteins which are also known as clotting factors. These are responsible for making sure that your blood stays in a fluid balance and does not get clotted. All of these are produced in different organs of your body, mainly liver. These in together form what is known as blood. When do you need to see a hematologist? You need to see a hematologist when you have problems with any of these blood cells. Either you have a low hemoglobin, or you have a low or a high WBC, you have low or a low platelet count. You may also be directed towards a hematologist when your blood clots without any reason, or when your blood bleeds without any trigger or trauma. You may also be directed to a hematologist if you have any inborn or congenital problems like thalassemia or sickle cell anemia, which are problems related to the formation or the adequate proportion of your red blood cells. You may also be directed to a hematologist when you require blood transfusions on a repeated basis, or when your hemoglobin is way too higher than normal. These are some of the conditions where a hematologist can help you. What else does the hematologist do? The hematologist also does something known as the bone marrow transplant. Bone marrow transplant in simple terms is known as Raktaropan, which means the hematopoietic stem cells or the seeds which are responsible for formation of your red blood cells, WBCs, white blood cells and platelets. When there is a problem with those seeds in terms of either a cancer or some inborn errors, one may want to replace them from another healthy donor. This is known as bone marrow transplant or a hematopoietic stem cell transplant. When will you be directed to a hematologist? You will be directed to a hematologist based on certain signs and symptoms that you may develop over a course of the period, or your blood tests, your simple blood tests which are known as complete blood count, or your bleeding or clotting tests may show some abnormalities. That's when you will be requested to see a hematologist. For more information, please log into our website or contact the Clinical Hematology department of the hospital.